Welcome to Medical Class 901 with Dr. Chi. My name is Dr. Chinelo Animalu, infectious disease specialist and professor of medicine. Welcome to Medical Class 901 with Dr. Chi. We are in the cold season, and therefore everybody's aware of the fact that this comes with its own issues, especially viral infections. And so what we're going to talk about real quick today would be the common infections that we are likely to encounter in this season. So the first three that, we worry about would be our influenza, the common flu, influenza A and B. And then you have the RSV, which is the respiratory syncytial virus, as well as the COVID. COVID is here to stay with us. Right now, we have a new strain that is really potent and dangerous, but the good news is that we have the vaccines that are available to help us protect ourselves, not just ourselves, our families and our loved ones and friends. And so as we travel, this season is almost to be with family, to be with friends. I'm encouraging everyone to take precautions to be safe. And so one thing that these infections seem to have in common is that they are spread through the respiratory routes, meaning that you can get these infections from somebody sneezing around you, from somebody coughing around you, from touching surfaces that are infected, like the doorknobs or TV, remotes and other things that people tend to share amongst themselves in families as well as other places. This is the season that people are going to be flying a lot to visit their families, their loved ones and friends everywhere. So be careful. If you're going to be in the airplane and you're sitting next to someone who is coughing, please put on your mask. At the same time, if you're sick and perhaps you have some respiratory symptoms, such as fever, you're coughing, your nose is running, you have itchy, watery eyes, you have a sore throat, and all these kind of symptoms, you want to protect not just yourself, but also people around you. So that will be the time to bring out your mask again and put on your mask. And we could never, ever forget hand hygiene, washing your hands. Remember, water and soap, 20 seconds and the minimum. Wash your hands very well. Or if you're in an area where you do not have access to water and soap, then you can use the alcohol-based hand sanitizer. This was something that was so emphasized during the COVID era. And so we kind of want to bring back all those mitigating factors again. So if, for instance, you have someone at home who is an elderly person or a young child or somebody who is immunocompromised, and by that I mean somebody whose immune system is not the way it should be, perhaps through some illnesses, maybe they're taking some medications like chemotherapy, or they're taking medications for autoimmune diseases such as lupus, rheumatoid arthritis, etc., then you want to be careful around those people because their immune system is not up to par. Simple infections like the flu might become a big issue. Also, infections such as the RSV, the respiratory syncytial virus, is kind of notorious for causing more severe infections in immunocompromised individuals, things like bronchiolitis as well as pneumonia. So you want to be very careful around these individuals or people, your loved ones, if you have them at home, or perhaps, their friends. So you want to be careful and protect them as well as protect yourself. My name is Dr. Chinelo Animalu, infectious disease specialist and professor of medicine, Division of Infectious Diseases.